Can you have a healthy pregnancy with diabetes, hypertension, or thyroid disease? So, when a woman is already suffering with diabetes or hypertension or thyroid disease before they conceive or before they become pregnant, the ideal thing is we need to manage these patients in a multidisciplinary care. And before any woman plans for a pregnancy with these comorbid conditions, they should always have an preconceptional counseling with the gynecologist and the obstetrician that they are planning a pregnancy. So, what are the things which we look for in the preconceptional counseling? We have to see whether her diabetic status is under control, her fasting post-lunch, as well as her 3 months previous diabetic status, which we tested by doing a HbA1c, should be within optimal, that is less than 6.1. Once the diabetes status is under control, we need to evaluate her rest of the organs, that is the eyes, the kidney, the heart, etc. Because the woman is already a diabetic and she is venturing into a pregnancy wherein her physical status has to be optimized before she becomes pregnant. The most important thing, what we say to these patients to these women who are planning for pregnancy with these comorbid conditions, we call it as a diabetes complicating pregnancy, wherein the complications which we come across could be increased rate of miscarriages, increased risk of preterm labor, premature labor, congenital abnormalities, and increased chances for cesarean section. So that is the reason why we need to optimize the diabetes status. There are certain medications which we have to alter once they become pregnant. More so, the oral hypoglycemic drugs can be changed to insulin, that is the injectables, and then plan for the pregnancy. So, including the hypertension. Now, hypertension complicating pregnancy, we call it as a chronic hypertension complicating pregnancies, wherein the drugs which we give has to be altered, changed to the more simple medications which can be taken during pregnancy, and have a joint clinic approach wherein the physician as well as the obstetricians can take care of the woman. So in conclusion, what we need to understand is a woman with comorbid conditions like hypertension, diabetes or thyroid disease should plan for pregnancy once her condition is optimized, the drugs are altered, as well as after preconceptional counseling, they can have a pregnancy, and the management should be in a multidisciplinary unit wherein a physician as well as an obstetrician can take care of her for a good pregnancy outcome. Thank you.
If you found this video useful, like, comment, and subscribe for more health updates.